I'm in the company of Vivian Wangashe, who is our sign language interpreter tonight. Let's get started. By December 2021, the Ministry of Health will have vaccinated 10 million Kenyans in the fight against coronavirus in the country. This is the promise of President Uhuru Kenyatta to Kenyans as he revived the commitment of the government to inoculate the public. Even with the government lagging behind in the vaccination exercise of Kenyans with the AstraZeneca vaccine due to shortage, the government has accelerated its plan in inoculating the public, with the target shifting to vaccinating 10 million Kenyans by December 2021 using the Johnson & Johnson vaccine. The projection of the vaccination exercise stipulates that 26 million people will have been vaccinated by 2020. The Johnson & Johnson that is being administered using a single shot is deemed to be cheaper.
For instance, we have already ordered 10 million vaccines from Johnson & Johnson, with the first consignment arriving in Kenya in August of 2021. But in the process of negotiating with this company, we also have managed to get a lower price. For the price of 10 million vaccines, we will be able to have them deliver 13 million doses.
For underage children, the government is looking into vaccinating 4 million young adults if the vaccine is registered by early next year. The intent being to achieve herd immunity.
With a vaccinated population of 30 million people, this will allow us to begin the journey for herd immunity against this pandemic, and this is our intention for the next 12 months.
With the Kenya Medical Research Institute embarking on the process of developing a vaccine for the coronavirus, with a possible candidate vaccine prototype expected in October, the government has formed a multi-agency team to see a possibility of setting up a human vaccine center.
It is now clear that we cannot exclusively depend on foreign partners and their systems to resolve our health crisis. And in that regard, we must substantially prepare ourselves for the next crisis before it knocks on our doors.
Interfaith Council now being tasked to give civic education on COVID-19 vaccine through engagement with private sector. The head of state maintaining that nobody will be forced to take the vaccine.
Once we begin the mass rollout in July this year, unfortunately some Kenyans have formed certain theories about vaccination and its effects. Although vaccination is free of charge and no one will be forced to get it, some education about it is critical.
With the country aiming at vaccinating 150,000 people every day from August 2021, only time will tell if this target will be achievable at a time when the globe is fighting the pandemic.